The $1.9 trillion COVID relief package includes a proposal that could help keep some seniors out of nursing homes. Joining us now is Ramsey Alwin, CEO and President of the National Council on Aging. Good to have you here on the show. Tell us specifically what's inside that relief package that could actually be of real use to keeping seniors out of traditional places like nursing homes.
Fabulous. Well, thanks so much for having me. The American Rescue Plan passed just a month ago is just an incredibly momentous package with $1.5 billion worth of community programs that the National Council on Aging fought to ensure were in the package. Programs that can provide a lifeline of services in community around nutrition and health services that can allow older adults, especially the most vulnerable, stay at home where they want to be. As opposed to in those institutions. The package also included $12.7 billion in home and community-based services, just an incredible infusion of support that will allow individuals to stay in their homes.
Now, Ramsey, I know that there was, a huge push to vaccinate as many senior citizens as possible, especially ones living in those nursing homes where we saw coronavirus really spread like wildfire. What are the hurdles that still remain to vaccinating all older Americans?
That's right. Over 80% of the deaths due to the pandemic were 65 plus, a third of which were in nursing homes, disproportionately women and communities of color. What we've really appreciated seeing in the state-by-state rollout are these approaches that prioritize older adults in institutions in particular. And also, we've seen incredible innovation at the community level. We have a network of senior centers that are deeply connected to older adults and have the trust of older adults. And where public health and senior centers have been able to partner in order to reach out to older adults, vulnerable, those that may have a healthy level of skepticism, we've seen really promising results in getting people connected and on track.
Can you talk to us a little bit more about the money in that relief package, the COVID relief package that's going to go towards caregivers? And I'm not talking even about professional caregivers, but say you have a daughter, a son, a cousin you're elderly and they can care for you. There is money in that relief package that would actually pay those people, even though they're your family, for those services. What does that entail, and just how critical is that to keeping some of these seniors out of nursing homes?
It's really essential. I mean, so many individuals receive care from family. That's what's most comfortable, most convenient. And being able to have access to the over $12 billion that were put in the American Rescue Plan in order to provide those in-home services is going to be extraordinary. Building on that, what the administration rolled out just this week in terms of the infrastructure package, we're looking at the potential for an additional $400 billion worth of home and community-based services supports to pay formal caregivers and informal caregivers. And we're just really excited and advocates to continue to expand those programs. The National Family Caregiver Program is just such a lifeline for so many families.
All right, Ramsey, let's connect the dots even more firmly for folks at home. How does taking care of seniors and also vaccinating as many seniors as possible be a boost for the economy? I think so many people think of, elderly folks as essentially economic drags, but I know that you're saying that this is actually an economic boost as well.
Oh, absolutely. The longevity economy, as we call it, the 50-plus market, stimulates over $7.6 trillion of economic activity annually. And so getting our older adults back on track, healthy, to be able to move about the country, participate in employment, consume as they see fit, provides an incredible ripple effect to our communities, to our overall economy.
Yep, do not underestimate the seniors for sure. Ramsey Alwin, CEO and President of National Council on Aging, thank you.